Our program is located in Elkhorn, Wisconsin, and that's located in southeastern Wisconsin. During their first year, our residents are able to spend time in Milwaukee in a very urban setting, but then they come here their second and third years to the program at Elkhorn, and they're able to have much more patient autonomy and get that full rural experience.
I really enjoy working at a small community hospital. Communication here is so good because everyone knows each other and we all work together in the different departments, especially as family medicine residents. We work in the emergency department, we work on labor and delivery, we work on the inpatient side, and they all know us. And it's a very different experience from trying to navigate a large hospital system where your only communication with some of the people that treat your patients might be via page.
Throughout your residency, you'll be exposed to medication-assisted therapy to treat opioid use disorder and other substance abuse disorders.
Another strength of the program is that we have a Suboxone Clinic. Everyone gets trained from their first year to see the patients in the Suboxone program, so you get 3 years of Suboxone training.
Rural health is a big part of our program, but rural mental health is an even bigger part with the shortage of psychiatrists and psychologists that are available to patients.
We really step up to fill that need for our patients, and I'm managing a complexity of psychiatric conditions that I never thought I would be responsible for, and that has been a really wonderful challenge, and it's been a very rewarding patient population to work with. I think our residents come out of our program well trained in how to handle the social aspects of medicine. When people think about a rural underserved population, they often have one idea of what that population looks like. But a rural population can be very diverse, both in terms of its backgrounds and in terms of its healthcare needs. We have patients who are coping with substance use disorders, patients who are coping with language barriers, patients who are undocumented and face insurance barriers, patients with transportation issues that make it difficult for them to even come to an appointment. And all of that is so integrated into the care that we provide. And I think we come away with a good sense of how to best support our patients, not just in the clinic, but with the aspects of their health that happen outside of the clinic as well.
So one of the ways that we try to integrate our residents into the Lakeland community is through doing a community health month where they're exposed to all the different services within the county that residents have the benefit of being able to use and take part in. Another thing that we do is help the residents get exposure to medicine in the prison and jail systems by allowing them to work at the county jail that's across the street from our clinic.
Our program is very supportive of work-life balance. Many programs say that they're supportive of those things, but ours really structures its program in a way that allows us to thrive. And it's been refreshing to be part of a program that really takes that seriously.
I like to live in a rural area because I love nature and I like going for hikes and running and just generally being outside, so I like that about this area. So some of the things that we do outside of our working hours are we'll organize small get-togethers. Sometimes it's just a small party or a wine tasting, and sometimes not even outside of work hours. We'll go on walks around the hospital. There's a lovely walking path.
One thing that I would want any medical student to know if they were considering our program is that when they come here to be a resident, they're going to be in a very supportive environment. We want them to become the best rural physicians that they can be and provide the training that makes them feel comfortable when they graduate, that they are able to go out and treat patients on their own in a rural environment where they might not always have a specialist to refer to.